So we are going to continue with the last bacteria that we are going to study in this course of microbiology. This is the last one, because next class is about viruses. So we are going to study anaerobic gram-positive bacilli. We are going to study only one, Clostridium. We study only one because we don't have time to study all, unfortunately. So Clostridium, things that we must remember about all Clostridium. Well, we are going to study 4 species, 4. And we are going to try to study Clostridium in a table. But before that, I'm going to remove this about tuberculosis and Clostridium. 4 species we are going to study. Things that we have to remember about Clostridium. Some of them you already know. Clostridium, all of these species that we are going to study today live in the environment. Like Bacillus, if you remember. Clostridium produces endospores, like Bacillus. And the pathogenesis, the virulence factors, the pathogenesis of these diseases is related with the production of very potent exotoxins. So, the same as Bacillus, like Bacillus. So Bacillus and Clostridium have many things in common. One difference, Bacillus is aerobic, Clostridium is anaerobic. Okay? So these 3 things are common for all. We are going to study 4. And to study this Clostridium, we are going to study inside a table like this. We are going to fill this table with the 4 species, Clostridium perfringens, Clostridium difficile, Clostridium botulinum, and Clostridium tetani. And we are going to say some things about pathogenesis, about transmission, about the diseases, something about the treatment, and something about prevention. So because we don't have time, and these contents are a lot, we are going to make it very, very simple, to put all the contents about Clostridium inside this small table, okay? So remember, before we start, about virulence factors, all of them produce toxins, all of them. So the pathogenesis is related with toxins. We start with the first one. We are going to start with Clostridium perfringens. So virulence factors, exotoxins, a lot, many different exotoxins. If you are interested in them, I explain you in at the end of the class, in complements for better understanding. The transmission of Clostridium perfringens may be through inoculation, so through the skin, inoculation, or through ingestion. When Clostridium perfringens is acquired through inoculation, the diseases that they produce are soft tissue infections that you already know. For example, cellulitis. You remember cellulitis? We explained 2 weeks ago. For example, myositis, infection of the muscles, or myonecrosis. This is the most severe. Myonecrosis is also called gas gangrene. This is very, very severe. Transmitted through inoculation. When Clostridium perfringens is acquired through ingestion, Clostridium perfringens will produce enteric infections. So infections in the intestine. This may be mild, food poisoning, that you already know, or more severe, this is called necrotizing enteritis. This is very severe. What about food poisoning? The mechanism is the same as Bacillus cereus or Staphylococcus aureus. Spores of Clostridium perfringens contaminate the food. So they grow on the food, they produce toxins in the food, and you eat the food contaminated. This is food poisoning. This is usually mild. However, necrotizing enteritis is a severe infection of the intestine, okay, that you will study in the future. And what about these soft tissue infections that are acquired through inoculation? Some of them may be severe. I show you some pictures. This is a patient with cellulitis, soft tissue infection, acquired through inoculation, sometimes severe. And this is a patient with myonecrosis, also called gas gangrene. This is very severe. This is the ICU. Look the bubbles, like this one. These bubbles are produced because Clostridium is anaerobic, and during the metabolism of anaerobic bacteria, a lot of gas is produced. For example, hydrogen, carbon dioxide. So diseases related with anaerobic bacteria, not only Clostridium, may show bubbles of gas like this one. Okay? This is a typical patient with gas gangrene, very severe. Possibly this patient will lose his leg. Some patients die. Okay, so we go back to the table. What about the treatment? The severe infections require antimicrobials. However, food poisoning does not require antimicrobials. For prevention, we cannot do anything. Just to prevent the contamination of the food and cleaning the environment. So we are going to start with the second one, Clostridium difficile. Clostridium difficile is a nosocomial pathogen. It's a nosocomial pathogen. And we are going to show a clinical case, a real clinical case, before we start Clostridium difficile. Look. Clostridium difficile, this is a clinical case that is real, okay? This is the typical case. And I show you this case because we will understand perfectly later what happens with Clostridium difficile. Look. This is a 60-year-old man. This man was transplanted some years ago. So possibly he is immunocompromised, possibly. And this man comes to the hospital complaining of abdominal pain and severe diarrhea. When we ask the patient, he says that 3 weeks ago, he suffered a sinusitis and he was treated with antimicrobials for the sinusitis. He was treated with cotrimoxazole. So it's very important. 3 weeks ago, he was taking antimicrobials for another disease, for a sinusitis. He was taking antimicrobials for 10 days. Currently, in the hospital, on physical examination, the patient has fever. His abdomen is tender. We perform a CT scanner of the abdomen, and we find that the right colon, the wall of the right colon is thickened. We perform a colonoscopy, so we enter in the colon, and we find many white plaques and red mucosa This is called pseudomembranous colitis that you will study in gastroenterology and pathology next year. So we are not going to say anything here about this. The patient has diarrhea. So we take a stool sample and we send the stool sample to the laboratory of microbiology. And what do we find? In the sample, Clostridium difficile grows. And this Clostridium difficile is producing toxins. This is a typical clinical case of a patient infected with Clostridium difficile. Typical case of a patient immunocompromised that has been taking antimicrobials. Okay, so what's the problem here? What's the problem here? Clostridium difficile is the most common cause of diarrhea related with antimicrobials. So antimicrobial related diarrhea. We are going to explain in the table. So we are here. Clostridium difficile is a nosocomial pathogen. It produces toxins, the same as all Clostridium, the same as all Clostridium. These exotoxins are mainly two. The TCDA, these are the names. The names are not important. And the TCDB. The TCDB is more toxic. But the names are not important. So what happens here? What happens here? This is a typical nosocomial and sometimes opportunistic pathogen because in healthy people, the intestinal normal flora can protect against Clostridium difficile. However, if people takes antimicrobials for another reason, the normal flora in the intestine disappears and Clostridium difficile may appear and cause disease. So the transmission of Clostridium difficile is through ingestion of spores. So spores are ingested. If the normal flora is healthy, nothing happens because the normal flora, the microbiota, is protecting against Clostridium difficile. However, if the normal flora is not healthy, the spores of Clostridium difficile will become vegetative and Clostridium difficile will grow in the intestine. This is the problem. And they will cause diarrhea. They will cause a severe diarrhea. Sorry. So we are going to say enteritis with diarrhea. This diarrhea sometimes is very severe. When this diarrhea is very severe, this is the clinical case that I show you. This is called pseudomembranous colitis. This is the most severe. So go back to the PowerPoint. So remember, it's important for you to remember that the host factors, so the normal flora in the intestine, is very important to protect the human body against other infections. The intestinal normal flora inhibits Clostridium difficile infection. However, if you take antimicrobials for another reason, for a long time, mostly if you are immunocompromised, the normal flora disappears and Clostridium difficile may grow. That is the problem. So what can we do with this? How can we treat this? This is wrong. If the disease is mild, if the diarrhea is mild, we can just stop the antimicrobial treatment of the patient. So if we stop the antimicrobial treatment, the normal flora will appear again, and the normal flora will control the disease. However, if the patient is severe, like the case that I show you in the clinical case, if the patient is severe, we must use antimicrobials to kill Clostridium difficile. These antimicrobials are usually metronidazole or vancomycin. But you don't have to remember the names now. I hope you study next year. How can we prevent? The prevention of these diseases is, because this is a nosocomial disease most of the time, so cleaning the hospital environment to remove spores, and using antimicrobials properly, only when they are needed and for the time required. Antimicrobials destroy the intestinal normal flora. That is the problem. So this is Clostridium difficile, a typical nosocomial pathogen. Before we continue, I forgot to tell you that Clostridium difficile, but also Clostridium perfringens, both are intestinal pathogens. So we have to write them in our table. That I don't know where it is. So we go to our table of intestinal pathogens. I show you now, wait. The table that you already have. This table is full of intestinal pathogens, and we are going to write here two new. Clostridium difficile, toxins, the TCD-A and TCD-B, and Clostridium perfringens, toxins, both because of toxins, okay? Perfringens. And this is the last bacteria that we are going to write in this table. Okay, so we go back to the table. And now we are going to try to explain the last ones, Clostridium botulinum and Clostridium tetani. They are very different. They are totally different. But we are going to try to explain them together because we don't have time. Because we don't have time and because they have something in common, okay? So why do we study them together when they are so different? Because both the disease that they produce, the disease that they cause is paralysis. The symptom is paralysis. Sorry, paralysis in English, not paralysis, paralysis. In both cases, paralysis. But this paralysis, in the case of Clostridium botulinum and Clostridium tetani, is different. In the case of Clostridium botulinum, this paralysis is flaccid. In the case of Clostridium tetani, this paralysis is spastic. And I hope you understand the meaning of these words in English. That's the reason why you must read the lesson before coming. So, flaccid paralysis and spastic paralysis. The name of the disease caused by Clostridium botulinum is botulism. The name of the disease caused by Clostridium tetani is tetanus. In both cases, because of toxins. In both cases. For Clostridium botulinum, the toxin is called botulinum toxin. And look, botulinum toxin is the worst, the most dangerous, the most dramatic toxin that we know in the earth. Is the worst. For Clostridium tetani, they produce two toxins, but the most important is tetanus toxin. Tetanus toxin is also called tetanospasmin. As I told you, as I show you in the presentation. Tetanus toxin. The worst is botulinum toxin, okay? What about the transmission? The transmission of both bacteria is different. The transmission of Clostridium botulinum is through ingestion. Ingestion of the toxin. Spores contaminate the food and Clostridium botulinum appears and the toxin is produced. So, ingestion of the toxin with the food. This is the most common way of transmission, but not the only one. Not the only one. However, for Clostridium tetani, the way of transmission is not ingestion, it's inoculation. Inoculation of spores into the skin or mucosas. So you have a wound, a dirty wound, and this dirty wound may be contaminated with spores. So Clostridium tetani will grow and it will produce the toxin, and the toxin will be absorbed. So the mechanism is different. And we are going to try to explain the disease. And to understand the disease, we have to understand the physiology of the muscle contraction. And I am not very sure if you have studied physiology already or not. I'm not very sure. If not, it will be difficult for you to understand. I hope you will study in physiology in the near future. So we are going to try to explain this paralysis. We start with Clostridium botulinum. So look, Clostridium botulinum, the disease is botulism. I show you here in this picture how muscles contract in normal conditions. This is the muscle and this is the motor neuron. The contraction of the muscle is produced because acetylcholine, this A, acetylcholine, this is the neurotransmitter. Acetylcholine is released from the motor neuron to the muscle. And acetylcholine binds receptors in the muscle, so the muscle is contracted. This is the contraction of the muscle in normal conditions. However, what's the problem with botulinum toxin? Botulinum toxin inhibits the release of acetylcholine. So this is acetylcholine. Acetylcholine binds the motor neuron and the release of acetylcholine is inhibited, is blocked. So because acetylcholine is not released, the muscle is not contracted. So even when you want to contract your muscle, the muscle is flaccid. Spores, as I told you before, spores of Clostridium botulinum may contaminate the food in cans like this one. When Clostridium botulinum contaminates the food, the spores, you can see something like this. This can contains Clostridium botulinum inside, and it also contains the toxin. So if you have a can like this one in your house, don't eat it. Look, the can is swollen. Why? As I told you, anaerobic infections, anaerobic metabolism releases a lot of gas. So possibly this can is contaminated with Clostridium botulinum. So if you have this in your house, don't eat it because maybe it's contaminated with botulinum toxin. This is a patient with botulism. Look at his face. His face is flaccid because he can't contract his muscles. This is the same. The face is flaccid, no contraction of the muscles. What's the treatment of botulism? The most important treatment of botulism is antibodies, antitoxin, immunoglobulins, antibodies against the toxin. This is the most important, antitoxin, as soon as possible. And the prevention of botulism, the prevention requires a very important cleaning of surfaces when you are preparing homemade food. Botulism may appear in outbreaks. Every year we have outbreaks of botulism. And these outbreaks are related with homemade food, like this one. So when we prepare this food, the conditions, the cleaning of the environment when we are preparing the food is very important to avoid the contamination with the spores of Clostridium botulinum. Look, currently, botulinum toxin is also used by dermatologists and aesthetic surgeons to make you younger, because if we inject botulinum toxin in the wrinkles in the skin, because botulinum toxin produces flaccid paralysis, you may look younger. So botulinum toxin, Botox is the name, is the brand name. Botox is used now in aesthetic surgery and dermatology for this, to make you younger. Anyway, Clostridium tetani. Clostridium tetani. Tetanus is also paralysis, but spastic paralysis. And what is spastic paralysis? I explain you now. Spastic paralysis, the patient with spastic paralysis cannot relax the muscles. So the mechanism is a little bit different. So this is how contraction works in healthy people, okay? I told you before that the contraction of the muscles is possible because acetylcholine is released from the motor neurons and it binds receptors in the muscles, so the muscle contracts. When the muscle is contracted, later the muscle must be relaxed. And how is that possible? That is possible because we have interneurons like this one that I show you here. And these interneurons released GABA and glycine, and these neurotransmitters are inhibitors of the muscle's contraction. These neurotransmitters, glycine and GABA, bind the motor neurons and the release of acetylcholine is stopped. So this is how inhibitory neurons work to stop the contraction of the muscles. However, what happens in tetanus? Tetanus toxin, tetanospasmin, inhibits the release of inhibitory neurotransmitters. So the contraction of the muscle cannot be stopped. So this is spastic paralysis. Spastic paralysis means that the muscle cannot be relaxed. This is a patient, a typical picture of a patient with tetanus. The patient is totally contracted. This is called opistotonos. Inhibitory neurotransmitters are blocked, so the contraction cannot be stopped. This is the same in a child. This is tetanus. We can see it in the face. This patient does not have tetanus, but I always show this picture because the appearance of the patient is like this one. The contraction of the muscles in the face, like this one, or this one, or this one. All of them have tetanus. Contraction of the muscles of the face. This is tetanus. So paralysis, the same as botulism. But if you look at the face, the appearance is different because tetanus is contraction, spastic paralysis. Botulism is flaccid paralysis because the mechanism is different. And I always show this picture when I teach this class, because here you can see all the signs that you can find in a patient with tetanus. Contraction of the muscles in the body and contraction of the muscles in the face, like this one. The treatment of tetanus, the most important is also antitoxin, but not the only one. But we don't have time to explain everything. So I think that is very clear explained in the class, okay? The prevention of tetanus is through a vaccine. We have a vaccine against tetanus. The vaccine is included in the DTP vaccine that you already know. Diphtheria, tetanus, and pertussis. And I also explain in the presentation very clearly the treatment and prevention. So we are not going to say anything because we don't have enough time. So I go back to the presentation. Do you have any question about Clostridium? Questions about Clostridium, about tetanus or botulism or the others?
I have a question.
Yes.
You said that the Clostridium botulinum toxin is very dangerous. So
the most dangerous in the world.
So how can they modify it to become the Botox?
It's not modified. It's the botulinum toxin without modification, but they use a very, very low dose. They use a very, very low concentration. So injecting this is not easy. When you inject Botox, you have to inject in the skin, and you have to take a lot of care not to inject in the bloodstream. When they use Botox, the concentration is very, very low, very, very low. However, if you check the medical papers, you will find that some cases of patients have suffered botulism because the toxin was incorrectly injected, but very, very few patients. So they use the toxin without modification with a very, very low concentration, very, very low.
Okay, thank you.
More questions? More questions? This picture that I show you is very important to prevent tetanus. Unfortunately, we don't have enough time in this class. But in this picture, I show you how to prevent tetanus depending on the wound, if it's clean or dirty, and depending if the people are vaccinated or not. This picture is very important. This is not microbiology. This is what it is. I don't know what it is. I think this is public health. So you will study again in the future, okay? But this is very important. The prevention of tetanus is very important. But I cannot comment anything because we don't have time. More questions?
No.
Okay, so I remind you two things. I remind you to answer the tests in the Sakai platform before Sunday, okay? It's already available for lesson 8 and lesson 9. And I remind you that if the university is open next week, because we don't know yet, but if it's open, we will have the midterm exam at the end of the week, okay? On Monday morning, we will explain you about the exam, okay? The exam, the midterm exam is easy. We will explain you on Monday morning. Actually, the exam is ready. So on Monday, we will explain you everything. If the university is open. If the university is closed, we have no idea, okay? So we will tell you on Monday. Okay, so thank you so much. I'm very sorry because this class is very long and we don't have enough time. It's very difficult to teach this when we don't have enough time. And it's very difficult for me to teach this using online teaching. It's much better in the class. But anyway, goodbye and good luck.
Goodbye.
Goodbye.
Too.